Well, I want to start by thanking you so much, Dr. Bechard, for joining us today on what is really an important conversation, and it's really something that is on the minds of so many people in Ontario. So thank you very much for being here with us.
Thank you for having me, Sandy. Always happy to chat healthcare.
And I understand you're a pediatrician.
Yes, I'm currently a pediatric emergency doctor in Ottawa, and I'm also the chair of a group called Canadian Doctors for Medicare. So I really care about improving our healthcare system.
Well, first of all, thank you for your service and being in Emerge. That's a huge and difficult job, especially when it comes to everyone's most special thing in the world, which is their kids. So having worked in Emerge, you are working currently in Emerge, you see people in some ways at their worst, or people that have no other where to turn or place to turn. What are you seeing changing? Are you seeing anything different than what has been happening in healthcare, say in the last 3 to 5 years?
Yeah, absolutely. I often think of the emergency department as a barometer of the pressure that the healthcare system's under because we don't really turn anyone away. So when patients have difficulty accessing care in other venues, we see that in the emergency department. I've heard others call us the canary in the coal mine, and I couldn't agree more. So I finished residency back in 2018, did a pediatric emergency fellowship here in Ottawa from 2018 to 2021. And then I've been in full independent practice over the last 3 years. And even during that relatively short time, the world of the emergency department is so different from what I trained in even just 3, 4 years ago in that pre-pandemic environment. I never thought that I would see wait times to see a physician exceed 18 hours, but I've seen that. I never thought that I would see people sleeping on the floors of our hallway waiting to be seen in the emergency department because we simply ran out of chairs, but I've seen that. And it just blows my mind that in this day and age, with all of our progress in technologies and resources, it really feels sometimes like we're doing battlefield medicine, stories from wars in the 19th century sometimes. It is rough out there, and my heart really goes out to the patients because as much as it's difficult for healthcare providers, I recognize that it's even more difficult to try and access care in this system or to try and help a loved one, especially a child, access care in a system like this. There has been studies showing that when you contract out to private for-profit investor-owned care, there does tend to be worse patient outcomes. And we see this in studies from the States, from the United Kingdom. We saw it during the COVID-19 pandemic, where unfortunately there were worse COVID-19 outbreaks in long-term care facilities that were for-profit or head chain ownership. There's a few reasons for that. One is that when you've got that profit focus, you can either increase your revenue or decrease your costs. To decrease costs, a lot of healthcare facilities will run with like bare bones staff, which is what we saw here in Canada during the long-term care facilities in the pandemic. And when you have fewer staff, you can usually get by until something goes wrong. And I can say that when we have a really critically ill, unwell patient in the emergency department, we can redirect and divert our resources so that we've got like 30 people in the room within 5 minutes to help out with the situation. But if we had a bare bones staff where you're just operating for the best case scenario, when those worst case scenarios arise, of course, there's going to be negative impacts on people's health. So that's what really worries me when we see this shift away from patients towards profit.
Yes, I agree, Dr. Bechard, that really part of the reason that the healthcare system held was because of the dedication and the commitment of healthcare providers like yourself and your colleagues. And I know that that's what's happening right now. We would be in a worse shape if everyone that was burned out in that system left.
Sometimes in my conversations with my friends, they think, well, what's the harm though? If I have the funds and I can pay for healthcare and I'm able to be seen in a timely manner and my problems addressed, aren't I taking myself out of the queue of the public system?
Right.
Is that really harming anyone? And I get that line of thinking, but unfortunately, there's a big flaw here, and that the bottleneck is really the healthcare providers and for facilities.
Right.
So if I'm paying to see a healthcare provider, we only have so many doctors and nurses available. So if those doctors and nurses are going to be seeing patients who are paying privately, then there will be fewer doctors and nurses to address the rest of us waiting in the public system. So we've seen in other countries like Australia and Germany, when they've opened up a two-tiered system wait times can decrease for those who have the funds to pay for it. But for the vast majority of people who are relying still on the public system, the wait times actually increase.
Go up.
Exactly. So it's a bit of a zero-sum game. We need to keep in mind that if we're having some people pay for faster care, it doesn't shorten the wait list. It just rearranges the wait list so that those with more money go on top. And
Right.
when I explain it that way to people, they start to realize what the concern and what the issue is.
Despite us asking many, many questions, I think people of Ontario would have a better picture of what's actually happening, and then they'd be in a better position to advocate, for healthcare that they used to have and that meets their families' needs. And I guess my question to you is that, we hear you, and you're in the system, we hear you, the official opposition, we hear you. People in the healthcare system are screaming, and we sound the alarm when we hear that. What do you think average people that are watching this interview and that want to be part of the solution can do?
Oh, that's a great question. I think that it's really important if you're someone in the public and you recognize the problems in healthcare, to do your best to stay educated on the issues. And I totally get that these are complex issues, even as somebody working in the system. It wasn't really until I did a master's degree that I fully felt like I understood the anatomy of our healthcare system, which is bonkers because in some ways it's even more complex than like the anatomy that you learn of the human body in medical school.
That's
But I
funny.
think taking a critical lens and looking at what frontline healthcare providers are saying they need is really key. And also being able to dispel some of the myths. I think one key myth that you've touched upon is that sometimes people think that private equals efficient and private equals faster and lower costs, but we've actually seen the opposite in healthcare. Now, I could see why these myths arise. I've been on government websites before, on the phone, the CRA, et cetera. It's not always an efficient process. But when we look at healthcare in particular, if we are sending public funds towards private for-profit investor-owned facilities, some of those public funds are going to end up as shareholder profit.
Right.
And money for shareholders. And personally, I would rather that my tax dollars go directly towards nonprofit facilities so that it's going directly towards the healthcare providers and the resources who are actually delivering care. And there were some articles that came out last year that showed that contracting out to these private for-profit and investor-owned facilities was actually costing the system more to do the same procedures that could have been done in our publicly funded nonprofit hospitals. So I think it's really important to take a critical look at some of the myths out there, and sometimes some of the myths that the industry is actually trying to promote because they get a direct financial benefit. I think we always have to follow the money and keep an eye on and think, why is someone telling me this, and what do they stand to benefit from putting forth this narrative? So I think that that's really key. And then, of course, when you're looking at voting in elections, first off, please vote. That's a really key thing. I really think that as a healthcare provider, voting is one thing that we can all do to improve our system and to improve population health. And please pay extra attention to healthcare platforms of parties. I recognize that there's so many different issues that are all important to us, but we often see time and again, healthcare is number one, or at least within the top 3 issues for voters at both federal and provincial territorial elections. And personally, I would not vote for any party that's promoting more privatization of care, whether or not that's asking people to pay for care more or looking out at contracting to investors and taking a more corporate model of care. As a healthcare provider, I can tell you that there's no evidence that this is going to be more official. I've only ever really seen problems arise from it, especially because it distracts from real solutions that we could do. There's much more things that have a stronger scientific evidence base, like those centralized referrals, like team-based care, like diverting our resources into primary care, that I think can actually help our system. And when we get distracted by this age-old argument, oh, let's open up a 2-tier system, that'll solve all of our issues, it really doesn't make sense. We see lots of countries with 2-tier systems that are facing very similar issues as we are. And it would be such a shame to dismantle, I think, probably one of the only remaining strengths that our current Canadian healthcare system has.
Wow, Dr. Bechard, you were in how you're a doctor, but boy, you should be in public speaking. You said that so well. I couldn't say it any better myself.